This is USMLE QA, USMLE material presented in a question and answer format structured similar to the first aid for the USMLE Step 1 book.
Question: What are autosomal dominant disorders? Answer: Autosomal dominant disorders are often caused by defects in structural genes and can affect multiple generations of both males and females. They can also have multiple, seemingly unrelated effects and can differ between individuals. Question: What is the importance of family history in the diagnosis of autosomal dominant disorders? Answer: Family history is crucial in the diagnosis of autosomal dominant disorders. With one affected parent, each child has a 50% chance of being affected. Question: Can you explain the concept of pleiotropy in relation to autosomal dominant disorders? Answer: Pleiotropy refers to the phenomenon where a single gene has multiple, seemingly unrelated effects. Autosomal dominant disorders can often be pleiotropic, meaning that they can affect multiple bodily systems or functions. Question: How do autosomal dominant disorders differ between individuals? Answer: Autosomal dominant disorders can be variably expressive, meaning that the symptoms and effects can differ between individuals. This can make diagnosis and treatment more challenging. Question: Can you explain the inheritance pattern of autosomal dominant disorders? Answer: Autosomal dominant disorders follow an inheritance pattern in which a single copy of the defective gene is sufficient to cause the disorder. If one parent is affected and has the defective gene, there is a 50% chance for each of their children to inherit the gene and be affected by the disorder. Question: What is the difference between autosomal dominant and autosomal recessive disorders? Answer: Autosomal dominant disorders are caused by a single copy of a defective gene, while autosomal recessive disorders are caused by two copies of a defective gene, one inherited from each parent. The symptoms and effects of both types of disorders can be different, and the inheritance patterns are also different. Question: Are autosomal dominant disorders more common than autosomal recessive disorders? Answer: It is difficult to say which type of disorder is more common as it depends on the specific disorder being considered. Both autosomal dominant and autosomal recessive disorders can occur, and they each have their own set of specific disorders. Question: Are there examples of well-known autosomal dominant disorders? Answer: Yes, there are several well-known autosomal dominant disorders, including Huntington's disease, Marfan syndrome, and neurofibromatosis type 1. Question: Can autosomal dominant disorders be treated? Answer: The treatment options for autosomal dominant disorders can vary depending on the specific disorder and its symptoms. In some cases, there may be no cure, and treatment may focus on managing symptoms and preventing complications. In other cases, surgery or medication may be used to treat the disorder. Genetic counseling may also be recommended for individuals and families affected by autosomal dominant disorders. Question: Are there any preventive measures for autosomal dominant disorders? Answer: Preventive measures for autosomal dominant disorders can vary depending on the specific disorder. In some cases, there may be no known preventive measures. In other cases, genetic counseling, prenatal testing, and regular screenings may be recommended to help detect the disorder early and prevent complications. Question: Can autosomal dominant disorders be inherited from one's grandparents? Answer: Yes, autosomal dominant disorders can be inherited from one's grandparents, as well as one's parents. If a grandparent has the defective gene that causes the disorder, they may pass it on to their children, and that parent may then pass it on to their child. Question: Are there any specific challenges with an autosomal dominant disorder? Answer: Autosomal dominant disorders can present specific challenges for individuals and families affected by them. Due to the genetic nature of the disorder, it can be difficult to predict how the disorder will progress and affect an individual, which can make treatment and management more complex. Additionally, the risk of passing the disorder on to future generations can also be difficult for families to manage.
Thank you for watching our Q&A format video. We hope this helped you learn, review, and retain knowledge needed for the USMLEs. For more information on this topic, check out the link in the description. Now, if you want to take your USMLE prep to the next level, be sure to check out all our courses, which are structured to follow along with the first aid for the USMLE Step 1 book. You can find us at usmleqa.com. And if you're watching this on YouTube, be sure to like and subscribe.